Good afternoon. My name is Dr. Libby Cope. I'm the health officer for the Makah tribe, and this is a health officer update for December 22nd, 2021. As of today, we have one active case in Neah Bay. That case and their household can add up to 9 total individuals that are in isolation and quarantine. There were no other individuals outside of their household that had close contact with this active case. All other members of the household have tested negative, and we are going to monitor the PCR test results closely and the family to see if there is any spread or if any of the PCR tests come back positive. This brings our case total to 161. This slide just shows the monthly case totals. As you can see, we had the large spike, which is attributable to the Delta variant, and then a decrease in cases quite rapidly in both October and November, as well as December. Yesterday's case is the first new case that we've had since November 23rd. Column County remains high risk, so the percent positive for all COVID tests that are being taken in Column County is 9.29%. The benchmark for that is 2%, so we want to see it below 2%, and it's been above 2% for quite some time. They had 2 new current hospitalizations yesterday and 2 new fatalities. Unfortunately, the rate of new cases per 100,000 in the last 2 weeks is up to 364. The benchmark for that is 75. These numbers the arrows are pointing to have all been increasing daily in the last week. This is just a graph showing the rate of new cases each day. There's the spike in the fall due to Delta. And then as you can see, baseline has not gone down too much. And then we are already headed now into the 6th wave. You can see the waves more clearly in Washington State's graph. So wave 1, 2, 3, 4, 5, and coming down. And then we are headed back into the 6th wave with the new Omicron variant. These charts just show the ICU bed capacity and hospital bed capacity in Washington State. The dark pink line on top is the total bed occupancy, and the light pink line is what percentage of those beds are taken up by individuals, patients with COVID-19. So 88% of all ICU beds are occupied right now. 16% of those are COVID patients. 91% of all hospital beds in Washington State are occupied right now, and 9% of those are COVID patients. And here's the trends for the United States as a whole. So you can see 1st, 2nd, 3rd, 4th wave, 5th wave, and definitely well into the 6th wave. This just shows the increase in cases, hospitalizations, and deaths over the last 2 weeks. The increase in testing is a good thing. That is in response to Omicron. It seems that individuals are willing to get tested, which is great. So the Omicron variant was detected first on November 24th. It pretty rapidly was identified as a variant of concern, and then and also confirmed to be present in the US right away in December 1st. And as of yesterday, it reportedly accounted for 75% of all COVID cases in the US. There's still a lot of research to be done, and scientists are working as hard as they can to figure out what we do and don't know. But here's what we know so far. So it does appear to spread much more easily than the Delta variant even. And the Delta variant spread easier than the wild type COVID that we were dealing with before. So definitely spreads easier. We don't have data on the severity. Certainly there's anecdotal data of it not being as severe, but we just need to wait and watch on how Omicron does in terms of severity. It's expected that the vaccines will prevent severe illness and death and hospitalization, but more breakthrough infections are expected. So those breakthrough infections are when an individual is fully vaccinated, they still get the infection, they still test positive, but have either no or mild symptoms. And as far as treatment goes, we need more data, but so far, one specific brand of monoclonal antibodies, the Regeneron, appears to be most effective, and STIC has sufficient supply of that. But again, we still need more data. Bottom line is that we already have all the tools that we need to fight Omicron, and those tools are the COVID vaccines and boosters. and masks and social distancing and testing. So our COVID vaccine efforts in Neah Bay have so far been quite successful. 84% of our residents who are 5 and older are fully vaccinated. Another 3% are partially vaccinated and most likely will become fully vaccinated once getting the second dose. 13% are unvaccinated. This data is from December 10th, and so we've had at least one vaccine clinic since then, and it's possible that these numbers are already up. And as you can see, these are just the numbers that pie graph is based off of. Showing the number of people who have had at least one dose of the vaccine, just close to 87%, and then fully vaccinated as close to 84. Last week, STIC did decide to discontinue offering the Johnson & Johnson shots. This is based on the information, pretty consistent information that we've had since the J&J vaccine was authorized, that it is less effective than Moderna and Pfizer for protecting against severe COVID. And then also just these increasing safety concerns about blood clotting in patients who received it, especially women ages 30 to 49. So because it's less effective and because there's really concerns about safety, we're just going to discontinue offering the Johnson & Johnson shots for now. Second tool is masks. So just a reminder on getting the most out of wearing a mask. Make sure it has a solid fit with no gaps around the sides and the chin. I want to show you my mask. This is a KN95, which I ordered just online, and I was able to get a pack of 50, I think, for maybe $5 or $10. So it's not too expensive, but I wanted to show you that it's got a solid fit on my nose and around the side of my face and my chin. And then when I breathe in, it kind of sucks in with me. And that tells me that it's got a good seal. So whether or not you wear an N95 or a KN95, you could stick with cloth, but if you do, please make sure it's got 3 layers and use this tightly woven cloth, like 100% cotton, doubling up if you don't want to wear a KN95 or an N95. So wearing like a surgical mask that has 3 layers with a cloth mask over it, that will help secure it to your face as well. But really it's important to wear a mask effectively. So testing, STIC is going to continue doing our Monday drive-throughs from 1 to 3 until further notice. We also do testing Monday through Friday from 1 to 3 p.m. Just call the clinic and let us know you need a test. And then at-home antigen testing, most of you probably saw that Biden had announced plans to set up a website for the federal government where you can go to that website, order a test to be sent to your home for free. They are also requiring that private insurance companies reimburse individuals who purchase them. STIC is working on purchasing, we do have the funds to buy and distribute these Buy Next Now rapid antigen tests. So that is in the works, and we'll have more information on when that will happen, how they will be distributed, and what to do once you get the test if you get a positive result. So a reminder on traveling and gathering over the holidays. This is not new information, but again, just a friendly reminder. So please don't travel or gather until you and your guests are fully vaccinated. If you're not fully vaccinated yet, please do that first and then wait, and then see your friends and family maybe in January. We really would prefer that you wait until you're fully vaccinated or your guests are fully vaccinated prior to getting together. Continuing to wear masks indoors. I know we're all so sick of it, but if you're around people who are not in your household group or not vaccinated, wearing a mask indoors is quite effective for preventing the spread of COVID. And then getting tested before and after travel. This isn't necessary if you're fully vaccinated and you're only going to be in close contact with other people who are fully vaccinated, but I do recommend it if you feel sick, regardless of vaccination status, if you've been around anyone who is feeling sick or showing symptoms of COVID, regardless of their vaccination status, and if you are unvaccinated or you're around individuals who are not fully vaccinated. Just a reminder about STIC holiday hours. So we are open the rest of today. We're open Thursday from 8 to noon, and then we close early with the tribe at noon tomorrow. So please make sure to pick up your medications and get any last minute healthcare needs done before Thursday at noon, and then we'll be closed on Friday. We will have on-call medical providers for after-hours emergencies. And then we'll be open next week, Monday through Thursday from 8 a.m. to 5 p.m., closing again on New Year's Eve. And then the tribe has extended the holiday break through January 3rd. So we will reopen on January 4th at 8 a.m. And then we'll reopen right to having another vaccine clinic. That's how important it is. So we'll have our COVID vaccine clinic on Tuesday, January 4th from 1 p.m. to 4 p.m. at the community gym. If you have any questions about the vaccines, any questions maybe you've been waiting for a while and you're not sure, you have one more question you want to ask, please don't hesitate to call me or call any of us here at the clinic. Your provider as well has all the information to share with you about why they're safe and effective and why they're our #1 tool for ending the COVID pandemic. All right, that's it for today. Our next public EOC briefing is Tuesday, January 11th. It's pushed back a week because the tribe extended that holiday break. So we'll have the EOC briefing on the second Tuesday next month on January 11th. Thank you. Take care. Merry Christmas, happy holidays, and a wonderful new year. And wishing the best for all of you and your families and friends and loved ones. Sure.